Hey guys, just wanted to speak a little bit about Cholithesiasis and Choledocolithiasis. Both of them sound quite similar. They're very similar, a lot of overlapping. However, they are very different, extremely different. So what do I mean by this? I want to speak about a little bit about the similarities. So the similarities here are that both diseases cause pain because in Cholithesiasis we're obstructing the cystic duct, which I'll explain. And then Choledocolithiasis is obstructing the common bile duct, which I'll explain. So both cause obstruction, both cause pain. The differences really lie in the diagnosis. So Cholithesiasis would lead to elevated bilirubin and would lead to elevated liver enzymes such as aspartate aminotransferase and alanine transferases. The treatment for this is that you would remove the gallbladder or you throw it out, you throw out the obstruction. The stones in the gallbladder. Not a cystic duct, sorry, gallbladder. And cholelithiasis means stones in the gallbladder and the bile ducts. There is basically going to lead to a lot of pain over here. We're going to have biliary colic, especially after meals. This is going to be due to the fact that there are stones in the duct. A biliary colic, it may come into the duct and it may cause pain. Symptoms: it may be worsening on eating the fat because that leads to increased secretion of the cholesterol. Progesterone, it may be elevated during pregnancy, and this leads to decreased contractility of the gallbladder. Gallbladder is not contracting that much. That can lead to quite a amount of sludge formation. And we can also have nausea and vomiting. We can have pain in the right upper quadrant, and that is below the breastbone, and it can be between the shoulder blades, and pain in the right shoulder. The pathology over here, gallstones, basically what happens is that these go and irritate the mucosa. And when this irritates the mucosa, it leads to quite a bit of acute biliary colic, obstructive jaundice. Obstructive jaundice means that we're not obstructing the bile duct. So now all of the bilirubin is kind of being built up in the gallbladder, and it's not been released into the stool. So therefore the stool will not have the bilirubin, and it will not be very brown. It will be rather very pale, and there may be also pancreatitis. Cholithesiasis can be reminded with the 5 fours. It's usually in females. It usually occurs at age 40. Sort of fatty food. You're going to be having some sort of foreign. You're going to be quite fertile. I think that means that you have a lot of fever. Not too sure about that. And this mnemonic, by the way, is from US 70. It's a very USC system of first aid book. Very common mnemonic. Diagnosis is very simple. You want to see where the stone is. You want to do an ultrasound and make sure to see whether it's right upper quadrant pain. So how to treat it? You remove it. If there's some sort of obstruction, you just want to remove it, throw it out, and just do surgery, do cholecystectomy, and that's how you treat cholithesiasis. So we spoke about this. There's more stones in the gallbladder. I said cystic duct, I meant to say gallbladder. Choledocolithiasis. Choledocolithiasis. Now you might be like, oh, it's saying all these terms. They seem very similar. But no, choledocolithiasis is a common bile duct. You're obstructing over here. So not only are you going to be leading to a jaundice, which is going to be occurring, but you're also going to be leading to elevated liver enzymes. So now you've involved the big boy over here, the liver. So that's the main thing over here. And you can have stones in the common bile duct, and this may lead to Murphy signs. What is Murphy sign? Murphy sign is when you inspire, and when you're going to go on a patient and tell them to inspire, and then they cannot complete the inspiration because they feel pain from the gallbladder, and that can lead to jaundice, fever, chills, obstructive jaundice, elevation of other factors. And the way that you want to really remember this is my bag has stones. So the bag over here is direct bilirubin. Why direct? Why not indirect? Because it's I think direct is going to be the one that's conjugated. So it's already conjugated because it's coming from the liver. We're not damaging the liver here. We're damaging the common bile duct. It can be aspartate aminotransferase, alanine aminotransferase, alkaline phosphatase, gamma glutamate transferase. Diagnosis: right upper quadrant ultrasound. You can do a ERCP. Sounds very complicated. Sounds like Chinese, but it is actually endoscopic retrograde choleangiopancreatography and magneto-resistant choleangiopancreatography, and that's it. Very simple. Just do these endoscopic retropancreatography and all of these choleangiopancreatography, and you can identify it and see it. So guys, just to review what we have over here: both diseases pain. Both diseases have obstruction. The main thing is that whether liver enzymes are elevated or not, and where is the stone obstructed, and also gamma glutamate transferase. And also we want to just remove the gallbladder. We want to remove the gallstone from the bile duct. We can use lasers. We can remove the gallbladder itself. So that's the main thing. Hopefully that makes sense. Hopefully that was useful. Thank you guys, and I hope to see you guys next time.